Hello, welcome to Dr. Caffrey's YouTube channel. We will be discussing the topic of addiction. It is a chronic disease or is it a moral defect? This is a question on many individuals' mind. It even becomes a debate. In this video, we will be investigating whether it's a chronic disease in the mind as a physical illness and possibly similar to a mental illness that is connected with the brain, or is it a moral defect that is in someone's head making wrong personal decisions? For some, addiction is a sign of weakness. It can cause individuals to seek out something that can harm them and lead them to take more of the substance. This can happen due to something called tolerance, in which the body becomes less sensitive to a drug over time, making someone basically immune to its effects and feeling good and relaxed. The article explains that a college student has a common problem amongst medical disease or moral defects, stigma attributions, and cultural model of addiction casualty in university populations peers. Addiction is one of the key elements caused by a chronic illness when triggered by tolerance. The individual builds the urge to obtain a substance. The cause for addiction would be the moral state of someone, and there are different types and levels of addiction where someone uses the substance to fix a defect. At the university, a lot of researchers have conducted surveys for the students who were at a younger age and were questioned to see what they knew about addiction and what answers they could offer to see how they would explain their view on addiction and where it comes from. Some explanations came from blaming and accusing individual abusing drugs, making them the real problems, and that there is no cure for it. Many surveys have been conducted that addiction can stem from multiple causes, such as mental health issues, which are often identified as a set of common contribution factors found in themselves and others. It is biological. Some say it occurs in the brain, or that it can originate in genetics passed down through families. Another type of factor is medication, which is use of drugs to cope with stress or negatively. Then others point out social issues, as some individuals struggle talking with others and even being affected by peer pressure, and sometimes are afraid of their surroundings, creating heavy amounts of anxiety. Lastly, hedonism is when someone seeks to find or obtain more of a substance. There are 5 main reasons for addiction that students share.
In addition to the argument of whether addiction is a disease or a moral defect, as part of this discussion, some people describe addiction as a brain disease influenced by environmental factors. The research also touches on moral interpretation less explicitly. Genetics and some parts of the brain circuits are the reasons why labeling matters for addiction. This research mentions that labeling is important because it helps to identify and emphasize the main cause of addiction, such as a dysfunction in the brain process, and influences causing addiction, like the environment and behavior. Some viewpoints from medical professionals explain that addiction can occur when someone has very weak self-control. Even experts find the condition difficult to fully understand because the brain of someone with a drug addiction is in a complex state of mind. An MRI study has shown that when someone has an addiction, many issues begin to form in the dopamine system, damaging the neurons of the brain. Oxygen levels in different parts of the cortex begin to decrease, leading to the decreased brain activation, which can impair decision-making and cause loss of control and difficulty thinking clearly. The medical use of drugs must be moderate, but a drug obtained from a non-medical source and exposed to a drug can cause serious damage and lead to compulsive behavior over time. The longer the drug abuse continues, the more brain activity will decrease. When people take drugs, it can lead to negative behaviors like destroying relationships, making irresponsible choices, and acting poorly. but all of this comes from the brain being impacted by drugs. There's promising news though. Brain damage caused by drug addiction can be treated over time. Recovery and healing can take place over about 2 years. After 2 years, the frontal cortex can fully recover, improving a person's ability to think, make choices, and exercise self-control. Another contributor of brain disease is tolerance, the main cause of addiction. At first, when you try a substance, you will find it intolerable, probably giving you a reaction, and you will have a strange sensitivity that is affecting you. The first time should have been final, but then when you try it again and start to tolerate whatever the substance has, you can become addicted to it and start abusing it constantly. Brain disease is considered a result of addiction rather than a moral cause, supported by evidence-based research that can be used. There is a need for empathy over judgment. To elaborate, researchers show that addiction is highly caused by a disease that affects parts of the brain. This can lead to long-term problems and can diminish a person's ability to control themselves from substance abuse. That's all. I hope everyone had a good time. Please subscribe, like, comment, and share with your friends. And thank you for stopping by Dr. Caffrey's YouTube channel.
Is addiction a medical disease or a moral defect?
It is a moral defect because you choose to take drugs and take them. It's not a medical disease because it only becomes medical when you get in the system. And that's when they're trying to feed you drugs when you're already on them. So being a personal drug user, I chose to do it on my own. And when you get into the system, they want to put you on drugs to keep you going, and that brings it back to morality because you're choosing to be on drugs and you're not being forced to take them to feel better, and you're doing it to get a high out of it. So in reality, it's all on you because you have the temptation to take them. So it's definitely not a medical effect because it's all on your own to take on drugs.
Now, follow-up question: How much of a responsibility do people have over addiction?
100% responsibility because it takes you to do it. You're looking for them, you're taking them, and you have full responsibility. There's no one else responsible but yourself.
And lastly, what's your view on addiction?
My view on addiction is it's sad because when you're in that hole, it's hard to come out of it. And it's sad because when you're in that hole, all you think about is wanting to do more drugs to get you out of that hole, thinking about it. So it's really just a mental thing. You could really overcome it. You need to want it. People say, oh, go to rehab, go to this, go to that. You could go to rehab, but you're still in your mind, you want to do it. So you have to mentally want to stop to be able to get yourself on the right path. So it's all mental thing. If you can't just say, hey, go to rehab, if you don't want it, you're not going to get it. So that's just how it goes.
All right. Thank you for answering my questions.
Of course.
Hi, today I'll be asking RN case manager Kay Dean some questions related to the topic of addiction. Should addicts be treated the same as other illness like depression and anxiety?
Yes, I do believe it should be treated in the same manner because it is considered a disease, so it requires the same amount of attention and treatment like any other disease.
And what would you say for people who have a different opinion about that?
Well, in nursing, we're moving towards evidence-based practice, so no longer are we depending on what we think we know, what our personal feelings are, but what is proven. So we're using, medical journals, we're seeing researchers from all over the world. So I would advise anybody else that has different opinions to check the data, see where we are, what we've accomplished through research, to see what is real and what is just based on opinion or, personal feelings.
Okay. And should healthcare systems prioritize treatment for addiction more than they are right now?
Yes, we definitely need to pay more attention and pool more resources toward this group of patients because for so long they've been neglected and not being treated, as similar conditions like diabetes, hypertension. So yes, we need to focus a lot more of our resources on this group.
I agree.
Mm-hmm.
And has your opinion on addiction changed over time?
Most definitely. I'm from the islands, so we generally, one of the things are, that we normally don't pay much attention to this topic. We brush it off as, poor lifestyle choices, but based on my career path and with my experiences moving from the islands, working in different countries, I've come to realize that my view has changed on it because I'm seeing it from a different perspective. Mm-hmm. Also because of my, I'm not only doing bedside nursing, but I'm now in case management where I'm seeing it from a holistic point of view, and now where these psychosocial conditions affect our discharge plans, and it also affects patient outcomes. So my viewpoint has definitely changed for in a positive light, I would say.
Thank you.
There were many answers from the surveyed students, pointing out what contributing factors cause someone to form an addiction. From stressful situations to fulfilling a need, the students primarily have two perspectives. One focuses on medical substance abuse, ranging from physiological conditions to mental conditions. The other focuses on the moral condition, grounded in self-control and personal choices. Students who learned more about moral perspective tend to emphasize responsibility and help individuals who are going through addiction, opposed to students who only began to learn more about medical conditions, who felt less confident in sympathy for those who were suffering from drug addiction and likely remained distant. The journalist elaborates that education based on drug addiction would result in multiple answers, given that the stress from using substances may unintentionally increase the moral conditions. Still, it can increase the stigma without a problem, implying that both conditions of moral and disease severity vary, and a treatment for drug addiction and therapy programs need to be created to prevent drug addiction from becoming severe in the future. In addition to the argument of whether addiction is a disease or a moral defect, as part of this discussion, some describe addiction as a brain disease influenced by environmental factors. In the Journal of Addiction, a medical model of the disease, this research mentions the importance of labeling as it helps to distinguish the main causes of addiction, such as dysfunction in the brain process, or rather nurtured from environmental influences. Some viewpoints from the medical professionals explain that addiction can occur when someone has a lack of self-discipline. Experts find this condition difficult to fully understand because the brain of a drug addict is in a complex state of mind. An MRI study from addiction, a medical model of the disease, has shown that when an individual has an addiction, many issues begin to form in the dopamine system, damaging the neurons of the brain. Oxygen levels in the different parts of the cortex begin to decrease, leading to reduced brain activation, which can impair decision-making, cause loss of control, and overall make it difficult to think clearly. The longer drug abuse persists, the more that brain activity decreases. When individuals abuse the use of non-prescription drugs consistently, it can eventually lead to negative behaviors, destroying relationships, making irresponsible and impulsive choices, and have behavioral issues. However, it's important to mention that all of these traits were caused by the individual's brain being impacted by prolonged drug abuse. Fortunately, there is promising news. Brain damage caused by drug addiction can be treated over time. Recovery and healing take roughly around 2 years. After this time, the frontal cortex can fully heal, improving a person's ability to think, make choices, and exercise self-control as before. To summarize, researchers show that addiction is caused by a disease that affects part of the brain. This can lead to long-term problems and can diminish a person's ability to control themselves from substance abuse. There is a need for empathy over judgment as a society to overcome this. That is all. I hope you learned something from this.
Please subscribe for more, like, comment, and share with your friends. Thank you for stopping by Dr. Caffrey's YouTube channel.